46% of Africans over 25 years of age have hypertension. That means when you're at your Christmas function and you take all the over 25s in the room, 1, 2, 1, 2, all the twos have high blood pressure or a level of high blood pressure. You're basically saying if they don't control it, those are heart attacks and strokes that are going to come into your family. Man, guys, this is something that is so serious and that we need to talk about. The reason I'm making this video is because we as Africans, as individuals, as Mama Nani, need to take control. We need to take control and understand this. Let's not have our heads buried in the sand and just assume that everything will be all right. Once we identify and know that we either have a risk factor, or once you go to a clinic and the nurse or doctor tells you your blood pressure is looking a little bit high, start taking action immediately. You do not need to end up being a statistic of someone who ended up with a stroke, ended up with kidney disease, ended up with a heart attack. And the fact that we're getting these conditions much younger means that you're going to be seeing 40 and 50-year-olds with strokes and heart attacks. And all that is avoidable. So let's take control. And the first way you can take control is by tracking your numbers. Just know what your normal blood pressure is. Know your baseline blood pressure. I'll give an example. My blood pressure tends to be around 115, 118 over 70s. The moment I start seeing a consistency in my blood pressure being even the high 120s and 80s, I know that that's a change. That's a change for me individually. And that's not normal. As much as the broad numbers or rules look, oh, you're still fine, it's a warning sign for me that I probably need to do some changes. Okay, so know your numbers and track your numbers. That will be extremely helpful. Then start with one lifestyle change. If you have risk or have been diagnosed, focus on at least one lifestyle change. I know when you come to the clinic, the doctor tells you, stop doing this, stop doing this, stop doing this, and you get so overwhelmed. Start with one.